Ladies and gentlemen, it's a pleasure to be a part of this a meeting, which is actually with Dr. Girdhar Gyani, who is the Director General with AHPI, that's the Association of Healthcare Providers of India, and a person who has been in the epitome of seeing that how hospital management and how these healthcare sector can be really improvised and taken to the course. It's a pleasure to connect with him, and today I have a short interview with him in terms of the prospects of 3D graphy in 3D printing and 3D technology getting associated with AHPI. Sir, a very good morning to you. It's a pleasure to connect with you, sir. Sir, what do you think about the technology, and how does this see as it grows as a prospect for hospital management and hospital as a center of healthcare?
You see, 3D printing has huge potential in the area of the medical technology. In fact, we have been talking about it in the dental, orthopedic, cardiology, and even in the neurology. These departments have the huge potential by which 3D printing can benefit the better outcomes in the terms of the clinical care. And today we have decided to partner or induct 3D Graphy, which is a consortium of 3D companies in our country, as our member. And through this partnership, we will reach out to our major hospital who can set up the 3D printing in their own premises, printers in their own premises, and also avail the services from the 3D Graphy centers which they are going to establish all over the country. So I am very happy that they are now our partner, and we will be working together for the betterment of our clinical outcomes in most of these specialties.
3D Graphy is also very keen in terms of seeing how democratization of 3D technology for dental and medical is also being achieved. So here is also a possibility that AHPI can actually help us set the pathway. So what do you think about the larger role that we could have working together in confluence, ensuring that there is more penetration and also democratization, because as we progress, the cost of the machine technology also needs to be easily accessible for all the hospitals, and which means finally the patient gets the benefit. So patient care is very, very important. We also believe in patient satisfactory index through this channel in terms of taking the course forward. What do you think about this going forward?
You see, we have more than 21,000 hospitals as our members. But for sake of better management and organizing, we have divided them in 20 regional chapters. So what we have proposed now, that we will be promoting the 3D printing technology through our 20 centers. So we will be asking 3D Graphy as a consortium to reach out to these regional centers, engage with the member hospital, and then try to see how some of them can actually establish either the 3D lab entirely if they are a bigger level of hospital. Let us say if a hospital has got more than 3,000 beds complete, they can set up their laboratory, otherwise printer, or otherwise they can just take services by taking membership from the 3D Graphy. So I think there are many options available, and this partnership now is going to reach out to the new heights, and the use of 3D technology will be availed by our hospital.
Sir, for your participation and for this partnership, and I'm sure we will be able to take this course forward. Thank you so much.